So good morning everyone, I am Danica C. Pellegrino and today I will be doing the head and neck assessment. So come and join me. So good morning ma'am, I am Danica C. Pellegrino and I am your student nurse. So today I will be assessing your head and neck. So for verifications ma'am, I would like to ask for your name. What is your name ma'am?
Gina Daguhoy,
So how old are you ma'am?
54,
54. When is your birthday?
January 4, 1968.
Okay. So next ma'am is I would be asking some questions ma'am and about your history. So are you experiencing lumps and lesions on the head or neck ma'am that do not heal or disappear, or nakaka-experience ka ba ng mga bukol or any
Wala.
cases? Okay. Do you have any difficulty to move your head or neck?
Wala.
So in your facial and neck naman po ma'am, do you experience frequent headaches?
Wala.
And nahilo ka po ba or nawalan ng malay minsan?
Wala.
Wala. About your past history, is there any previous head and neck problems, traumas, or injury?
Injury? Wala.
Okay ma'am, about your family history, meron po ba sa family mo po na nagkaroon ng head or neck cancer?
Bako, wala.
How about migraine or headaches po? Family history.
Headache. Normal naman. Headache.
Okay. About your lifestyle and health po, ma'am. So, do you smoke or use tobacco po?
Wala. Dili.
Okay. Do you wear hats or helmets?
Wala po.
So, how about your sleeping posture po, ma'am? Your sleeping position.
Takilid. Sa hayang.
Okay. How about your type of recreational activities during your free time? Ano po yung minsan ginagawa mo? During your free time, ano po yung mga hobbies na ginagawa mo?
Kanta-kanta.
Okay. Is there anything po, ma'am?
Wala na.
I will just close the curtain, ma'am, for your privacy. So, assuming that I have already closed the curtain for the patient's privacy, and today we will start the assessment na. But before that, I will just sanitize my hands with alcohol. And the next that I will do is to wear gloves. What language do you prefer, ma'am? Do you prefer English or Tagalog?
Tagalog.
Okay, Tagalog. Okay, so as we start the assessment, ma'am, for your head and neck, first I will just inspect your face and then palpate your head. So, I will just ask for consent, ma'am. Can I touch your face or some certain parts of your body?
Okay.
Okay, let's start. Can you remove this first now? I will just observe your scalp. So observe from the back. So, as what I have observed, ma'am, I haven't seen any scars, lesions, or parasites like lysis or alopecia, and your head is symmetrical and also round, and it's erect, and also I observed that your head is in the midline naman, and it's normal findings. And the next thing that we will observe, ma'am, is your facial symmetry or your facial movement symmetry. So, okay. Okay. And next is I will be checking your cranial nerve or your facial nerve, ma'am. So, please do the things that I will tell you to do, ma'am. Can you please raise your eyebrows? Okay. Blink your eyes, please, ma'am. Okay. And then close your eyes tightly. Okay po, you can open your eyes. And then, can you please smile like this? Okay. Can you frown po? Okay. And then, can you please puff your cheeks, ma'am? Okay. As what I have observed, ma'am, I can see any abnormalities naman when I checked your facial symmetry or facial movement symmetry and your cranial nerve. And there is no drooping naman po on your face. Hindi naman po siya nagdo-droop sa kabilang side at sa kabilang side. Pantay lang po siya. So, that's a good thing po. That's a good sign. So, the next part, ma'am, is I will be palpating your temporal artery. So, allow me to touch your face, ma'am. Can you please bite your teeth? Release po. Okay. So, next is I will be palpating your temporomandibular joints. So, can you please open your mouth, ma'am? Okay. So, as what I have observed, ma'am, there is no swelling naman po. And did you feel any tenderness or pain po as I let you did the procedure?
No.
Okay. And do you feel headaches or do you have headaches in these past few days? So next, ma'am, is I will be checking your neck, inspecting your neck. So, please. Okay. Can you please sip a water po? And when you drink po, can you please hold first the water in your mouth? Okay. So as what I have observed po, ma'am, I can see that your trachea po is in the middle line, and also I haven't seen any bulging po sa pag ano mo po sa process. And also po, normal naman po yung pag-up. Nag-up naman po siya sa paglunok mo po. And did you feel any tenderness or pain po while I let you did the procedure?
Wala.
Okay, that's good. So the next part for our assessment, ma'am, I will be checking your cervical vertebrae. So I will check it posteriorly po. Ito po siya i-check. can you please look on this side, ma'am? Okay. This side din po, ma'am. Okay. So, I observed po, ma'am, na there is no irregularities naman po as you did po what I instructed you, and that's normal finding po. So, can you look to the ceiling po? Okay, look to the floor po. Can you look to this side? How about this side, ma'am? Okay. Do you feel any tenderness or pain when you do it?
Wala.
Okay. That's good, ma'am. I'll be palpating your trachea, and I will do it posteriorly. So I will just feel it. So I can observe po, I can feel that your trachea is in the middle line naman. And can you please swallow, ma'am? Swallow po. Swallow din. Swallow po, ma'am. Okay. So, I can see that your tracheal rings are in the middle line naman, and it's working. So, that's good. Next is, can you look in this side, ma'am? This side po. So, okay naman po yung trachea at nasa mid po siya. So, the next part for our assessment, ma'am, is I'll be auscultating your thyroid gland if there is any present roots. So, can you please inhale, ma'am? Hold your breath. Okay, inhale again, ma'am. Okay, you can exhale now. So, I can feel naman po that there is no present roots and it's functioning well naman po. So, for the last part of our assessment, ma'am, I'll be palpating your lymph nodes. So, first, allow me to touch your face again. So, I'll be checking or palpating your preauricular nodes, which is in front of your ears. And then your post-auricular nodes, which is behind your ears. Next is the occipital nodes. So next is your tonsillar nodes. Next is your submandibular nodes. Relax lang po yung face. Next is your submental nodes. This is the superficial nodes. Next is the deep cervical chain nodes. Next is the posterior nodes. Next is the supraclavicular nodes. That's the last part of our assessment, ma'am. And if you have any questions or clarifications or any concerns or about your health po, I'll refer you to your attending physician, and she will explain everything that you want to know po. And the purpose of for this assessment po is to treat your necessary needs po if there is any abnormal findings, but I haven't seen any abnormal findings naman, and my advice po is to drink your vitamins, and then drink a lot of water, and also eat balanced diet. And there is thank you for your cooperation, ma'am. And is there any questions that you would like to ask? Okay, thank you.